Hello, everybody. This is Marla Neufeld, and welcome to my podcast, The Surrogacy Space. Thank you for joining me. Today, we have the very wonderful and knowledgeable Davina Fankhauser with Fertility Within Reach. She is a wealth of knowledge on anything pertaining to insurance. She's important in the advocacy world. I'm so grateful for you to be here today. So thank you for joining the show.
Thank you for asking us to participate. It's a pleasure to always work with you.
Thank you. As my surrogate says, it takes teamwork to make the dream work. So that is true in this whole process. So I'd love to hear, what is Fertility Within Reach? If you could just explain the big picture concept of what you do.
Great question. Thank you. So we are a national nonprofit, and we help people access fertility treatments and fertility preservation. We do that in a multitude of ways. So we create educational material to help patients know when to see a reproductive endocrinologist. We work with advocacy and legislation. We help nonprofits get started, so we have more advocates out there. We offer a grant program for adolescent oncology patients and transgender patients to cover the cost of storage before they undergo treatment that could render them infertile. There's a lot that we do, but what we love to do is work with others to make it happen.
That's awesome. And what inspired you starting this organization?
I went through infertility challenges without resources and without insurance coverage. And so I think knowing how difficult it was financially, emotionally, on our marriage, I just didn't want anyone else to have to go through what we did. And we made a lot of the mistakes that I think most people do, and it was costly. We transferred multiple embryos to try to optimize our chances, and my son was born very premature, which was one of the scariest things. So again, I just didn't want anyone else to have to do this. And when I experienced success passing legislation in Massachusetts to update their definition of infertility, I thought I really wanted to make it easy to help other people advocate and make that change.
And what's the importance of that definition being revised? What implications does that have in the laws and the fertility world?
So what we did was we had them correct the definition to update it. So women over 35 and over could seek treatment after 6 months of trying to conceive. And if someone miscarried, they wouldn't have to start the trying to conceive from the beginning to meet that biological clock of either 1 year or 6 months of trying to conceive. Whatever time you spent prior to your pregnancy counted. So if someone miscarried, if they tried to conceive for 4 months and they were under 35, so if they tried to conceive for 4 months, miscarried, then when they tried to conceive again, they would only have to try to conceive another 8 months rather than a whole year. Does that make sense?
And at that point, does that have the implications with health insurance? Then what, I guess, happens when they reach that time period?
Then they can receive benefit. So previously, the insurance companies were saying, well, you became pregnant, so you have to start your year over. And we made it so that a pregnancy loss wasn't considered fertility anymore. So the previous time of trying would then count toward that period required for insurance benefits.
That's incredible. I'm sure that's just helped so many people to be able to change that definition and provide benefits sooner than later.
Thank you. I think what's really exciting is with advocacy, legislative advocacy, once something happens in one state, it then opens the door in other states.
Right.
This could be good or bad.
I was just thinking the same thing.
It's important that the legislation is good legislation, not just
Yeah.
any legislation.
Well, that kind of leads me to my next question is what challenges do you see kind of nationally about regarding access to fertility treatment?
One of the challenges that I have tried to really address is fertility preservation legislation. A lot of the legislation is only for cancer patients and or iatrogenic infertility, which means the infertility is caused by medical treatment or medical care. But somebody with diminished ovarian reserve who desperately needs fertility preservation, that it's not caused by medical treatment. And therefore, they're not receiving the benefits. So we've done legislation in a state where they did a cost analysis, and it showed to add it to people with medical conditions that could lead to infertility, it was only an increase of 2 to 4 cents per member per month. So we're really trying to break free and educate that this really could be offered to more. And then the other thing is for storage to be included. We're trying to really educate legislators that you can't have fertility preservation unless there is a storage component.
Yeah, because those costs add up for sure, and it's years and years.
Absolutely, especially for adolescents who are experiencing issues. So we're really trying to do a good job of educating legislators so that they'll be more open. But sometimes it can be a long battle when they've seen legislation passed already in other states.
Right. Absolutely. And as far as talking about those frozen embryos, I'm curious your thoughts on what happened in Alabama regarding giving personhood status to frozen embryos. Kind of what issues do you foresee with that type of ruling and the implications it could create nationally?
Right. Well, we did a very quick response where we emailed the states that we felt were at risk of also then adopting personhood legislation or pushing forward personhood legislation and reaching out to them. And basically what we did was, because we know insurance companies will often do a projection of benefits beyond the coverage of infertility, they come up with their premium cost by projecting into the future. So what we did was, when we shared data with the legislators, we said, okay, in 10 years, this many babies have been born in your state as a result of assisted reproductive technology. If you, and we try to educate them a little bit, but what we also understand from working in legislation in some of these very conservative states who are somewhat anti IVF, that we try to share not only the benefit of having the not personhood legislation, which is all of these babies being born, but also share, some of the dangers that are involved with these type of benefits. And I have to say, I think most legislators can be good intentioned, and they are often just uneducated. And so we get responses from all political parties where they want to thank us for sharing the information, asking us what other states are doing in terms of language to protect IVF, to be able to have. And so they want to know, what can they do so that they are doing something that they believe is right for their constituents, but also allows IVF to continue. And there's this balance they really just want to be educated.
Like in Alabama, it's like the law was so overly broad. I don't think they even realized that the repercussions would be IVF just stopped. And that's why we saw that immediate kind of, especially in terms of legislation, like overturning of that law, like to allow treatment to proceed.
It did. It did. I do think it is not what they did was a perfect solution.
Right.
So when states like Idaho, they were asking me what type of language, I would give them part of the language that was used in that bill. But I do think that patients have a right to file a civil claim if
Right.
something has taken place.
Yes, they did. It was now the correction was overbroad in its own way, almost absolving clinics and storage facilities from any liability.
Exactly. And we are patient advocates. So we're like,
It's like a
okay.
ping pong of like, stop everything, now do whatever you want. Like, where do we?
But I think that this is what ART legislation has been. I mean, I've been working on legislation since 2005 in this field. And I
Okay.
think every state that passes something, we learn from them. And that's why each new state, we try to make it better. Or we may have to make some compromise. Like if we're working in more of a conservative state, we may have to make some compromises that we wouldn't
Right.
necessarily have to do in others. So but it's still very possible. I no longer think that it's impossible to get coverage in a conservative state.
Okay.
A bill that we just had passed in Connecticut, it was to remove all discrimination from providing IVF benefits in Connecticut. So if your employer provided a benefit and you happen to be LGBTQ plus, you can no longer be denied the benefit because there is no discrimination based on sexual orientation.
Hmm.
So,
Oh.
and our sponsor was a Republican sponsor.
Hmm.
And she was essential. Her name is Tammy Nuccio, Representative Tammy Nuccio of Connecticut, was essential to getting this bill passed. So I've learned so much over the years that I'm not afraid of working with everyone.
Right, because you have to get things done. Got to be nice. And who's typically reaching out to you? Are they patients? Is it lobbyists or clinics? Like, who are typically the people you're working with?
So some of it is organizations, and some of it is people who aren't patients. In Connecticut, was a young, I'm going to call him a young man because he was like 26. So to me, he's a young man. But he founded a group called Affordable Families. And together we worked with Lisa Rosenthal, who is with Loom Fertility, and we co-authored this legislation in Connecticut. So Mario came to me. I asked about bringing in Lisa, and we worked
Very cool.
together. Yeah, and we brought in doctors and attorneys, and everybody worked together to do this. And I think you always have to do that when working with legislation. You want to work with attorneys to make sure it's legally accurate, and you want to work with doctors to make sure that it's medically appropriate.
Right.
So that teamwork that makes the dream work is
there we go again.
Reality, yes.
And what's your background?
I used to be a teacher.
Wow. So you taught yourself everything with all this advocacy work? Because this is very specialized.
It is very specialized. I think experience, and then just.
And you've been doing it a long time now, too.
Doing it a long time. So even the information that I share has evolved. Yeah, our nonprofit started as Fertility Within Reach, become your own best advocate. And we taught everybody in handouts and stuff how to advocate for yourself. And we found out a lot of people are too exhausted to advocate for themselves. But there are definitely people who are ready to do it. And so we kind of learn to help at a macro level, um, where it's organizations and a larger level, and then the micro level, the individuals who do need the support to make a difference, and to get what they need. So we create educational material for employers, and we create educational material for patients. So try to go from all sides to support this.
And I know your website, which we'll put the reference to at the end of the show, references resources for people to seek out grants and financial kind of assistance, because that's always like a question that's asked: is there a way to help me pay for this?
Right. And there are ways, but I would say there's not a general one way for everybody, which is why we list the grants. And we've shared in the past, there are people who are great at crowdfunding. I personally am not great at crowdfunding.
It's tough to ask for money for whatever reason.
Which is a challenge when you're a nonprofit. But that I can ask for legislation. Asking for money is difficult for me, but there are some people who are great, and some people who are wonderful at fundraising. We knew a woman who she worked at a bakery, and then on her off time, she would have bake sales and make thousands of dollars.
Wow.
And then use that to help pay for her treatment. So we want to encourage everybody to do what's comfortable for them. And because if they extend themselves too much in something that doesn't feel right, they may stop and give up. So that's why we try to give all different opportunities to access treatment.
That's awesome. I think that'll be a great resource for people listening to check out on your website. I mean, there's so much on your site broken into all the different things that you do. So I think it'll be very helpful.
Yes, thank you. And we do, like, a lot of our literature, we put it all online. So anybody can download it, they can print it, they can share it. I know when I was going through treatment, all of my money was saved for fertility treatment. I wasn't buying a new car or contributing to the economy. I couldn't afford memberships or to buy things like that. So it was important to me that we provide our resources free, so everybody can access them.
Yeah, I think that's really wonderful. And having gone through my reproductive issues myself, I very much respect that. And, I'm sure it's invaluable to so many people.
Thank you.
Yeah. And given that I'm in Florida and maybe a lot of my listeners are located in Florida, just curious if there's anything in Florida regarding, I know you work a lot with like helping get coverage for infertility. We spoke about at the beginning. Anything in Florida that is on the books that people can know about?
There's nothing right now. And I would say I have shared suggested legislation with different fertility doctors in Florida. So they're very much interested in advocacy. But it does take an effort. It takes a group of people to make it happen. We're not based in Florida. We're happy to help and support and guide, but we aren't going to be the people on the ground.
Right.
So there's not active fertility benefit legislation right now. There was a bill regarding reproductive health to kind of protect Floridians, that you would have access to the treatment, but that bill did die in a hearing. So, or a second reading, I think, in the legislative process. So work still has to be done in Florida. And if anybody wants to get together and work on it, I'm more than happy to help and encourage. And we have our interns that can do some legwork as well. But it does take some time and commitment to make it happen.
What are a couple examples of states that have just great, like the gold standard in insurance benefit coverage?
I would say, let's see, I used to think Massachusetts, but not anymore. It's very general. And when the laws are general, it allows the state insurance departments to create the regulations. And the state insurance departments are frequently in touch with the insurance company lobbyists. So they already have relationships connected. You don't want to have legislation that is very general because I've now been a part of legislation. This is where compromise comes in,
Yeah.
where they've been general and I don't feel good about it.
But better than what it might have been before.
It's going forward anyway. So I do think more specific is better. We just saw that in Maine. I was part of that bill getting passed. It was very general. The state insurance department basically said 2 IVF cycles, which was not what we had asked for
Right.
originally. But again, better than nothing, but still, I think it's harder sometimes to fix it, but we shall see. I would say states that do a very good job, Delaware did a very good job. I think what we have tried to correct with Connecticut makes Connecticut better, but we're still working on a new version of the bill to improve it even more. There are states that did a dollar amount limit, like Rhode Island, which when it first passed in the 80s was fantastic.
Right.
But now with the cost of IVF, it's really maybe 3 or 4 IVF cycles. So I think it's things that have been known, again, because everything is evolving.
Right.
It changes very quickly.
So interesting. I mean, you can really just outdate itself within, a quick period of time.
It does. And that's what I've learned over the years and why you have to be, sometimes it takes a half an hour to work on one sentence, right? Because you want to make sure that that language is not going to be outdated. It's not going to hurt anybody now or in the future.
Right. Like our Constitution, like how they did that.
Right?
Kind of like marvel at how these things are done.
Right.
Well, I just wanted to thank you again. And I'd love if you could share with our listeners, how can they find, what is your website for people to find you?
Thank you. So the website is Fertility Within Reach, all one word, fertilitywithinreach.org.
Okay.
Yeah, that's the best way to find us. There is a contact us if somebody contact us that way.
Wonderful. We will share it as well with our listeners. And I thank you so much for your time today and all the work you're doing.
Thank you so much. I appreciate it. If I could just say one more thing.
Absolutely.
Third-party reproduction is a priority. And in every bill that I write, I say that there is coverage for IVF, IVF with third-party reproduction.
That is awesome.
Just so you know, I'm always thinking of.
Thank you. Thank you. Because that's something, I was looking at with the grants is back in the day, it was for IVF, but then not past that with third party. So thank you. If enough people need help, it builds upon itself to make change.
Absolutely.
Well, thank you so much, Davina. I appreciate you joining us today.